This is Dr. David Cruz here for White Coat Medicine Talks, here to talk to you about COVID-19, the infection, the disease that is caused by the coronavirus 2 that is out there. And so now the city of Laredo has enacted an emergency disaster policy, a declaration that for the next 2 weeks is going to help us to do social distancing, basically. So a lot of the places that we frequent, a lot of restaurants or bars or locations that we go, fitness centers, are going to be closed in the indoor or the dining areas for restaurants. And drive-thrus are still going to be available, deliveries will still be available, so things will still be available. A lot of things will be normal, except they're practicing this distancing so that we don't spread the virus. We know viruses spread very, very easily, and the best way to do it is to not be in contact with people so that we don't spread the disease. Now, how else can we prevent the spread of this disease? Of course, the distance is one. We want to wash our hands. They recommend 20 seconds soap and water. If there's no soap and water, you want to get some type of Germ-X, Purell, something that cleans your hands and kills bacteria and viruses on your hands, and use that. It has to have at least 60% alcohol in it. We do want to sneeze or cough into your clothes, into the shoulder this way, but not out into the open. If you use tissues, make sure the tissues are thrown away, and wash your hands afterwards as well. Also, try to not be touching your eyes, your nose, your mouth, because we touch those, touch something else, touch them again, you'll get the infection if that coronavirus is there. So those are certain things that we have to take into consideration. Then we only have one positive case in Laredo, so that's a good thing. But as more positives come around, we have to make sure that we're in contact and we are aware of these things so that we can know to stay away from certain people. Now, we know that the elderly are the worst as far as the infection getting worse in them and affecting them drastically. We know most people will recover. If you ever had the flu, you'll feel something like that, because the flu really hits hard sometimes, and it can also affect the people that are immunodepressed, the elderly, and so we worry about that community of people. Now, if we've been in certain meetings already here with the hospitals and with the city and with different groups of doctors. If you've been to a hospital, you know that they've already changed the policies. So be respectful of those policies that the hospitals have, because they're trying to prevent the disease. I know that we want to be there with our loved ones, but there are certain rules and regulations that we're going to have to follow so that people don't get sick and spread this virus even further. There's always a limited capacity at hospitals, there's limited ventilators, all that type of stuff. So we have to be mindful that we don't want to get a lot of people sick. So this social distancing is a good thing. The city enacted this. It's going to last for 2 weeks, maybe longer, depending how it goes. It's a good thing. I applaud them for acting so fast and so swift and moving forward with this, because I think it will help the medical community better deal with what's going on and get better prepared. Now, we have been preparing for this, and we have been in meetings to know that we will have to change things and how we deal with this. Different doctors are going to deal with it in different ways. So contact your physician and see what are the changes that are going to happen there in those facilities that those doctors are in. Everybody will be a little bit different. I know I'm going to handle it a certain way. I've already put out messages to some of my patients as to how we're going to deal with things. There are some messages on my door as well, and we will be doing things a little bit differently. Luckily, for the Medicare population, the government is allowing us to do more video, Skyping or FaceTime and things of that sort to make those visits happen so that we take care of our patients as well as we can. Can you go to your doctor's appointments? Yes, you can go to your doctor's appointments and you will be seen. You just have to make sure that you're calling your doctor to make sure that they're not changing appointments times or doing it differently, so that you'll know exactly what to do. It's very important to continue taking care of yourself. You got to take your medicines, you got to take care of yourself, because if not, you'll put one problem on top of another problem, and things will get worse, and that's not what we want to do. We want to make sure that the people out there are well taken care of, and that's our job. Now, we know that certain things will be affected. You know that we talked about the fitness centers, the gyms, the restaurants, the entertainment facilities, movies. All of these things are going to have to be closed, and so that's going to affect a lot of people. They can't have quinceañeras, you can't have parties, you can't have all these other different things that a lot of people may have already planned. But you know, what can we do? We have to be patient, because that's what we have to do to take care of ourselves and take care of our community, and our community comes first before any personal things. Talking about personal things, shopping. Guys, leave things for everybody, okay? Don't hoard. There's no need. There's a lot of everything, except when you take it all, then there's nothing left for your neighbor. So your neighbors also need all the supplies. And you know, if you just buy what you need, that will be good enough. You don't have to keep on buying and hoarding all these different things. Make sure that you leave enough for the rest of the community, because everybody needs to take care of themselves and take care of their families. And by them taking care of themselves, they'll be able to really take care of everybody else, because they are watching themselves to make sure that they're okay as well. Now you're going to talk about symptoms. Symptoms, we talked about it. It's kind of like the flu, right? It's you're going to have fever. Usually it's a high fever that you can have. You might have body aches, chills, cough, and if you have difficulty breathing, then those are things that have to be evaluated by the doctor. Now, if your doctor listens to what you said and he believes that you have shortness of breath that is serious, he's going to send you possibly to the emergency room. They'll usually call the emergency room beforehand, and then that way they'll know that you're going and you're going to show up, just in case they need to treat you for and test you for the virus itself. Not everybody's going to be tested. I know there's a fear out there that people want to get tested. They want to see if they have a virus or not. Most of the infections that we see out there are viruses. There's a lot of different viruses that cause a lot of different infections. So yeah, a lot of times they'll tell you, yep, you have an infection of a virus, but we don't know which virus at this time. That's okay, that's normal. And they'll have to try to figure that out, and they'll do other tests. Maybe they'll do a respiratory panel. We have to rule out flu, we have to rule out strep throat, we possibly do a respiratory panel. They might do even a chest x-ray before, and depending how all that is, if your symptoms are still there, then maybe they'll test you for the coronavirus as well at that time. Tests are limited, so we have to watch out. We just are most of the people that will get the coronavirus are going to be treated at home with self-quarantine, and they won't have to be in the hospital. They're not going to end up there, but they will be checked on, and you do have to check in with your doctor to make sure that you're doing well, that you're not getting worse. And so those are the ways that we're going to deal with a lot of these. Now check with your doctor again, so that you know exactly how they're going to deal with situations. You can always get information from the coronavirus hotline that the city has. That number, I do have it here. So the hotline here in Laredo is 956-795-4954. That hotline is open 24/7. You can ask questions and see what's going on. That may specifically tell you a little bit more about what is going on here in Laredo with the different emergency declaration that they passed, and so that may help some of you understand it even better. So it's not a time to panic, it's just a time to be conscientious, be careful, wash your hands, look at the things that you do, distance yourself from people if you can, so that we can actually take care of everybody in this community and we can get through this with no problems. Guys, thank you for watching. Like and subscribe if you can, and we will keep talking about this and other things here on White Coat Medicine Talks. Take care.